Joining us now live is the White House's drug czar, if you will, and he's done a lot of work on opioids. The opioid crisis, the Trump administration spending a tremendous amount of time and effort on that, and we have applauded their efforts. Kellyanne Conway, been on our show, as you know, many times, has been leading that effort. And White House Trump administration drug czar James Carroll joining us now. Jim, great to have you with us, sir.
Good morning, John. It's so great to be on the show and be with all your listeners.
Jim, tell me about what you guys are focused on now. I mean, the opioid crisis, you spent so much time on that, and it's rare in this town that anybody gets results with anything that they do that the government's involved in, right? I mean, it's very rare. I've been here a long time. You know how it is. You make a statement, there's a press conference. At the end of the day, you don't do anything. But you guys have done a tremendous job in attacking the opioid crisis that has affected so many people. Give us an update on that, and then tell us what your focus is now going forward, Jim.
Well, we really have made a progress here. The president has made this one of his top priorities. I'm the principal drug advisor to the president. I oversee the $36 billion that the entire administration is working on to combat this crisis. And what we're doing is making sure, in my office, I'm here at the White House, that the administration is laser focused on this, that what we're doing is that we're reaching people who need help. We're spending more money on that than ever before, and we're seeing results in that more people are getting treatment than ever before. We're spending more money on prevention, making sure that the next generation of people aren't addicted to this. And then, of course, we are going to secure our country from these poisons that are coming in. John, almost all the drugs that are killing us are coming from outside the country. You know, the president loves our citizens, loves our people like I do and like you do, and he is going to protect our country, have a strong border, and make our country safe.
In your position, James Carroll, as drug czar for the United States, explain to our listeners, because it's not your typical secretary position, it's not an ambassador, it's a little bit different outside of the box, but still needs Senate confirmation. Just explain how your job, like how you coordinate things and how that works.
What we do is by overseeing the budget, John, just like how you decide what you're going to do by spending money there, that's what President Trump is doing. He is directing these agencies to spend money that way. It's my role, and I'm blessed with a great staff of about 100 people here at the White House. And not only are we working with the U.S. government as a complete whole-of-government approach, but what we're also doing is working internationally. I just got back about 2 weeks ago from Mexico. 6 months ago, I got back from China before the current scare of health. And I'm meeting with, my counterparts over there. Their attorney general, their secretary of defense, and making sure that they're fully engaged on this issue, like President Trump has insisted from them. And so we're getting more cooperation than ever before. We're making sure that law enforcement here in the U.S. is absolutely committed to going after the people that are trafficking in these drugs. And then the people that are addicted, we're getting them help.
Let's talk about those that have been addicted to opioids. Jim Carroll, drug czar, Trump administration, live with us. When you attack the treatment end of it, like a lot of us understand how we're stopping them from coming into the country. I mean, we understand that the good changes that have been made. Doctors can't prescribe now, an entire 100 bottle, which is how this whole thing started, really. For those that are affected, addicted, walk us through, Jim Carroll, what the treatment touch points are.
What we're doing is making sure that people can get treatment, even if they don't have insurance. We're expanding Medicaid to cover individuals. And I'm really proud to say we launched a website just recently, about 8 weeks ago, findtreatment.gov. You can go in. It's completely anonymous. You just put in your zip code, all sorts of and you can find treatment centers in your area that are state approved. So they're following, the appropriate standards of care. But you can find them and do drop-down menus of if you have insurance, if you don't have insurance. If there's a particular, need that you want, there's all sorts of choices to personalize and get it in your area. I'm headed down to Central Virginia today and down, all the way to the southwest corner. I'm really have a great opportunity to be with Congressman Morgan Griffith down there. He's been a champion here in D.C., fighting for his constituents back home, and we're making sure resources are getting to him and all across the country. And I'm really proud to tell you that President Trump's work is paying off. For the first time in almost 30 years, we have seen a drop in the number of overdose deaths, and that's because everyone is coming together under the leadership of President Trump. We're making sure that communities get help, that families get help, and we are going to secure our country from these drug traffickers abroad who are trying to send these poisons here.
Jim, I so much appreciate what you're doing and the kind words about Congressman Morgan Griffith, who's one of my best friends in the world, and he's just a super guy. Let me ask you this, Jim, since you've been in this job, why has the opioid crisis hit rural areas so hard?
I mean, I think really part of it is, it is so cheap, whether it's opioids, whether it's pills that are being diverted, or overprescribed from some of these pill mill doctors, or whether it's methamphetamine coming in. It's almost all from Mexico. It's coming into these rural areas. And so that's why, I'm so proud to be able to work together with Congressman Griffith, who's just a rock star, in making sure that we're helping folks in rural America. We just released a new resource guide for people in rural America. Folks can just Google White House or U.S. Department of Agriculture Rural Resource Guide for opioids and find help in how to combat this in their neighborhoods, whether they're in a big city of Richmond or whether they're down in Wise, Virginia, where I'm headed today.
Why are you coming to Southwest Virginia? Why not rural Minnesota? Is there a sense of urgency?
Well, I travel the country every week. Next week, and in fact, on Monday, I'll be back in Virginia as well. I'll be up in Warrenton, another one of your where you have a lot of listeners. And then
Right.
Tuesday, I'm headed to Texas. And so I am on the road, making sure I'm meeting with citizens, making sure I'm seeing what's going on so I can get back here to D.C. and make sure that we're getting resources to these folks. But I'm going down to Wise today and tomorrow to be with Congressman Griffith, to see the work that he is doing down there and listen to him about the resources that he needs for his folks down there so we can get them there. He is just working hard, and I'm really proud to go down there.
Drug czar, Trump administration going to Southwest Virginia today, Wise County, with Morgan Griffith and other places, been working on this very hard on the opioid crisis. Drug czar, Jim Carroll. So, Jim, what was your background and what inspired you to get into government?
Well, I started my career working for the government. I started as a state prosecutor in Virginia in the Commonwealth Attorney's Office up in Fairfax. And so I started prosecuting drug cases at the beginning of my career. Immediately prior to this, I had been the deputy chief of staff at the White House for the president. And that's when I found out that I had a family member that had a dependence. It started with opioid prescriptions. And I realized, that I really needed to get more involved in this issue because, like so many families, I have a personal story. And so I came over here to lead this effort and to make sure that we're getting out across the country. This week I met with President Duque of Colombia. He was here meeting with the president. And so I had a meeting with President Duque, and we talked about the cocaine that is coming here from that country. As I said, I was, meeting in Mexico 2 weeks ago. I was in China 6 months ago. And so I'm out there not only nationally, but internationally to be able to combat this crisis. That's what the president expects of me. John, that's what you expect of me as a taxpayer. And that's why I want to make sure that I'm helping people.
Getting it done. How do you coordinate policy, politics? What's your relationship with Kellyanne? Fit this all together for us in a box.
I'm so appreciative of Kellyanne. She and I work hand in glove. She's been on your show numerous times. She's out there talking about it. She's making sure that the messaging we're putting out is absolutely consistent with President Trump's vision. And so, isn't it wonderful? Not only I've got the president talking about this issue, I've got the first lady talking about this issue with her campaign of Be Best, and I've got Kellyanne, as just a master communicator, a principal counselor to the president, making sure that all of the messaging, everything that we're doing, whether it's advertising, to kids and making sure they get the prevention message, to making sure that every member of the cabinet is talking about this. I'm just so fortunate to partner with her and, her expertise in terms of communications and just thinking about how do we reach people.
Sounds like the A-team to me. You guys are getting it done. Normally and look, I'm going to go back to different administrations. I'd have administration officials on my show, past administrations, as I get there, but nothing ever got done, Jim. It was like so frustrating, right? You guys are getting it done. You got the A-team. Jim Carroll, I know your staff is saying, Jim's got to go. You got to roll. Get to Southwest Virginia. Jim, thanks for being with us today. I really appreciate it.
Thank you so much. I look forward to coming back and telling you about my great trip.